The Omicron variant is expected to become the dominant strain in Singapore within a few weeks. Health Minister Ong Ye Kung told Parliament that new daily Omicron cases could rise to 3,000 then. It accounts for about 4 in 10 of COVID-19 cases here. Mr. Ong says that Singapore's key objective remains living with COVID-19 as an endemic disease. Safe management measures will be tightened as a last resort if the healthcare system is overwhelmed.
There are two factors working in our favour. First, high percentage of our population is vaccinated and more are getting their boosters every day. Second, unlike many European countries which have to contend with a double whammy, a concurrent Delta and Omicron wave, we have only recently gone through a Delta wave. So we are not likely to have to ride through two rapidly rising infection waves.
Mr. Ong also stressed the importance of vaccines in protecting against severe illness. Last year, unvaccinated people accounted for 70% of COVID-19 deaths. Almost half of the population have received their booster shot. But Mr. Ong says it's too early to tell if further shots are needed. And on the issue of inoculating children, leader of the opposition, Pritam Singh, asked if other types of vaccines could be considered, such as the protein-based Novavax. He cited the concerns of some parents over mRNA technology.
The concern is really a visceral one about the long-term effects, the fact that this vaccine, we've heard of emergency approvals and so forth. To that extent, will MOH allow such parents to wait until non-mRNA traditional protein-based vaccines are approved for their children's inoculation so as to give them more choice and to assuage their concerns?
But with the impending Omicron wave, I think we should act quickly. And we do not want to rule out that even a small percentage of children can get very sick. We might be looking at a significant absolute number. The children vaccine, Pfizer-BioNTech Comirnaty, has gone through extensive clinical trials. And during the clinical trials, it was shown to be safe and effective.
Workers' Party MP Sylvia Lim also asked if there's a risk of underreporting of local infections, given that some people who self-test positive do not report it to the authorities. Mr. Ong acknowledged her point, but said it's not possible for every country to report 100% of its cases.
Whether it's chickenpox, whether it's influenza, we can't report every case. And that's what endemicity means, which is many people get it. Many people are able to recover without it officially reported.
Mr. Ong added that Singapore continues to do a fair number of tests. Over 20,000 PCR and 150,000 ART tests are done daily. MP Xie Yao Quan also raised concerns about Omicron bringing a crunch on testing facilities. Mr. Ong assured that Singapore has plans to ensure a steady stock of test kits. He added that runs can happen when people panic. Well, that's why the government is informing people ahead of time about the Omicron wave.